A key design feature of experimental studies is the use of placebo. A placebo is a dummy treatment. Now, keep in mind and remember the word treatment. This is still an intervention, so it is not without any potential consequences. It has of no real benefit. However, it can make people feel better or worse. In that case, it would be a nocebo effect. Placebos are inert. They do not directly cause the placebo effect. However, they can cause indirectly some effects. For example, if you were in a class with me and I told you that we have a pub quiz today, probably, I would make your blood pressure go up. Maybe you would sweat a little bit and you feel nervous. So without me even giving you the pub quiz, you would have some reaction. That reaction would be a placebo or even a nocebo effect, because you would not be feeling good about it if that was something that I was going to do, but I didn't do it. So there are some ethical issues in using placebos as more and more drugs become available for certain treatments. The question is, do you want to withhold a drug that is beneficial? And the answer would be no. When you're testing a new drug that you're not fully sure how it would perform. So in those cases, using a comparison that is the standard treatment may be better. However, keep in mind that if the standard treatment we know it has positive effects, the new drug, the difference between the effect of the new drug and the standard treatment will be smaller, and so your power will be lower than if you were comparing to placebo, which has a little effect. Although, up to 30% of responses may actually be due to placebo in potentially. So the placebo should look, taste, smell the same as the active drug. So you should not be able, neither the investigator nor the patient, be able to determine whether something they're taking is a placebo or not. There was a study where the patients were able to open the capsules and test them, and even though the capsule looked the same, but when the patients tasted the capsules they were supposed to ingest, they were able to tell the difference between the active drug and the placebo. So they were able to tell whether they were on placebo or not, which then defeated the purpose. So here's a question. What would be the best placebo for a study of aspirin for headache? So are the options: no treatment, a sugar pill, Tylenol, liquid aspirin, or none of the above. Hit the pause button, think about it, and when you're ready, we'll start again. So this was the answer I got from a group of students. The majority answered sugar pill, and a few others answered no treatment or none of the above, and nobody answered Tylenol or liquid aspirin. So no, the Tylenol obviously is an active ingredient, so that would not be appropriate as a placebo. Liquid aspirin would look very different from like a tablet of aspirin. And no treatment, again, the patient would know whether they're getting nothing or the treatment, so that would not work. The sugar pill is, what do we mean with sugar pill? So we don't really have a good definition of that. But if it was actually just sugar, that could actually be helpful for headache potentially. It could have some effect. And so the sugar pill is really also not a good option. So the answer is none of the above. So now let's take a look at the case. There was a publication on the use of hyaluronic acid in the management of recurrent aphthous ulcerations. So recurrent after ulcerations are essentially canker sores. They occur in about almost half of the general population. They can be quite painful. They usually occur in teenagers or individuals who are growing up. And so they were given, the participants were given either hyaluronic acid gel or a placebo gel. So this was the result. They looked at pain measured on a visual analog scale. That was from 0 to 10. And then they measured, so essentially this is the higher the score, the more pain. This was a baseline, and then they gave, so they placed either the placebo gel or the gel containing the active ingredient. And they followed the participants for up to 60 minutes. So these are the results. In pink right here, you can see the placebo, and here you can see the active treatments. So the conclusion was that there was a significant reduction in pain with both hyaluronic acid and placebo. So based on these results, would you recommend the use of hyaluronic acid in for patients with aphthous ulcers? Is the gel with the hyaluronic acid more effective than placebo? Okay, you want to hit the pause button and think about this. Now we have a significant p-value with a significant reduction in pain. So do we want to give a patient hyaluronic acid? Well, the problem is that we have a reduction in pain in both treatments. And you can see that they started actually, in fact, the placebo started a little higher. So, in fact, for regression to the mean, it probably would decrease more. But in this case, they're almost parallel, and they continue to be parallel effects for both the placebo and the drug. This means that they both reduced the pain, and that so the question then is maybe it's not, so there is a placebo effect or perhaps an effect of the gel itself. Maybe the gel acts like as a barrier. So giving the hyaluronic acid makes no difference. So that it makes no difference whether you have a gel with the hyaluronic acid or the placebo. So there is no need in this case to use an active ingredient, which may have potentially some adverse events. So here's another question. Why is a placebo control a good idea? So is this study a good idea because the investigator will not know the treatment used, or because a patient may respond identically to placebo and active drug, or all of the above? You can hit the pause button, and when you're ready, we'll start again. So here's the answer that I received from some of the students. All of the above was the majority of the answers, and a patient may respond identically to both, 35%, and there were a few that thought that the investigator will not know the treatment used. Now, the placebo is really something that is related to the patient, and so the investigator may or may not know the treatment used. Even if the investigator knows what treatment is being given to the patient may still be taking a placebo and not know the treatment. So answer 1 is not correct. The answer is number 2. A patient may respond identically to placebo and the active drug. And we've seen that in the previous example. So if you do not use, if you're simply using one drug and you see that the patient feels better, that you have no idea whether that is due to the drug or to some effect of the patient. Some, the patient thinks that it's getting better because they think they're getting the drug. So now let's take a look at this study design, and What design is this? To treat multiple wounds in a patient with second-degree burns. That was the purpose. The methodology was the application of an XYZ gel in the clinic twice a day for 5 days. All the wounds healed. The conclusion was that the study showed that the XYZ gel may accelerate wound healing. Hit the pause button and think about the type of design, and then when you're ready, we'll start again. Okay, so this one is a single patient. We have no comparison. There is no placebo or even another comparison. So this one is a case report.